Can heart blockage happen even without chest pain? Yes, and it's more common than you think. Every 40 seconds, someone in the US has a heart attack, and many of them had no warning, no chest pressure, no dramatic signs, just silence until it was too late. But not for you, because in the next few minutes, you will discover 3 hidden signs your body uses to warn you before something deadly happens. So if your heart health matters to you, listen closely. This might just save your life. Sign number 1. Extreme fatigue, not the kind you get after a long day or a bad night's sleep. I'm talking about a deep, unexplained tiredness that hits you even when you've done almost nothing. You wake up feeling tired. Simple task. Walking upstairs, grocery shopping, folding laundry suddenly feel like climbing a mountain. And here's the scary part. Most people ignore it. They think they're just getting older or blame it on the stress. But in many cases, this is your heart struggling to do its job. Let me break it down. Your heart's main job is to pump oxygen-rich blood to every part of your body. When the arteries are healthy and clear, that blood flows freely. But when plaque build up and when those arteries start to narrow, your heart has to work harder. It's like trying to push water through at the blocked hose. Your muscles don't get enough oxygen, your brain feels foggy, and your energy tanks. This is why fatigue is often the first and most overlooked warning sign of heart blockage. Now ask yourself, are you getting tired doing things that never used to bother you? Are you short of breath after small activities like climbing a flight of stairs or carrying a bag? Do you feel drained in the afternoon, even if you haven't done much? Do naps or rest no longer seem to fix the tiredness? If you said yes to even one of these, you need to pay attention. Let me share a real story. A 38-year-old school teacher in Texas started feeling tired all the time. She was active, healthy, and had no history of heart problems. But over a few weeks, she found herself needing to sit down after just walking across campus. She couldn't finish grading papers without nodding off. Her family told her to rest more. Her friends thought it was burnout. Then, one day at school, she collapsed. No chest pain, no warning. At the hospital, tests showed her coronary arteries were 80% blocked. The fatigue was her only clue. And she didn't know it was her heart screaming for help. That's the danger. We think a heart issue has to come with drama, chest pain, a dramatic collapse, ambulance sirens, but in reality, it can start with your energy quietly disappearing, and by the time you feel something stronger, it could already be serious. Your body is smart. It tries to warn you early, but we're too busy, too distracted, or too stubborn to listen. Fatigue is not just being tired. It's a red flag that your heart may not be getting or giving enough oxygen, especially if it's new, sudden, or getting worse over time. So what should you do? First, don't brush it off. Don't assume it's just stress or itch. Get a basic heart checkup. Ask for an EKG if you are over 35. Request a stress test. You deserve clarity, not guesswork. Second, track your symptoms. Write down how often you feel the fatigue, what you were doing, how long it lasted. Patterns reveal problems. And third, start walking. Even 20 minutes a day can make a difference. Movement improves circulation. It helps your heart strengthen. And it gives you clues about what your body can handle and what it can't. Extreme fatigue with no clear reason is not just about being tired. It's a signal. And it may be the first one you get before something worse shows up. So the next time you feel wiped out, ask yourself, is this just a long day or is this a deeper warning? Your heart doesn't shout, it whispers. Are you listening? Sign number 2, pain, but not where you'd expect it. When we think of heart pain, we imagine a person clutching their chest, like in the movies. But in reality, the pain from heart blockage doesn't always strike the chest. Sometimes it shows up in places that seem completely unrelated. This is what makes it dangerous and easy to ignore. Here's what to watch for: pain or tightness in the jaw or neck, a heavy aching feeling in the left arm, a burning sensation in the upper stomach, often confused with acidity, a strange pressure between the shoulder blades, heaviness or discomfort in the left shoulder. These are all known as referred pain because the nerves that carry signals from the heart also connect to these parts of the body. So when your heart is struggling, your body might send pain signals to your jaw or your arm or even your back. And here's the problem. Most people never connect that pain to their heart. They think it's a pulled muscle, a dental issue, acid reflux, or even just stress. But in many cases, it's the heart. Let me give you a real example. A 46-year-old man went to the dentist complaining about jaw stiffness and dull pain. He thought it was a cavity or grinding his teeth at night. but the dentist found nothing wrong. The pain came and went for weeks. Then one morning, he collapsed at home. At the ER, they discovered he had 90% blockage in a main coronary artery. The jaw pain, it wasn't dental, it was cardiac ischemia. His heart wasn't getting enough oxygen. That's the power of referred pain, and that's why this sign is so dangerous. Now ask yourself, do you get sharp or dull aches in your jaw or neck? Do you sometimes feel a burning pain high in your stomach, especially after walking or stress? Do you get tingling or heaviness in your left arm? Do you feel tightness behind your shoulder blades? If these things show up out of nowhere, and especially if they are new or getting worse, don't ignore them. This isn't muscle soreness. Muscle pain comes from movement. It usually gets better with rest, but heart-related pain, it often shows up when you are not even moving, or during stress, anxiety, or after eating. It may fade and come back. That's the trap. It doesn't feel serious until it's too late. Let me be clear. Not all pain means heart blockage, but pain that's strange, unexplained, and persistent, especially in the areas we just talked about, needs to be checked. Doctors call this an angina equivalent, a pain that's acting like angina, but without the chest pressure. So here's what to do. First, don't wait. If the pain appears suddenly, lasts more than a few minutes, or is paired with nausea, sweating, shortness of breath, or dizziness, go to the ER. It's better to get checked and be wrong than wait and be too late. Second, listen to repeat patterns. If the pain keeps coming back, even if it's mild, get a cardiac evaluation. Ask for an ECG, blood test, or CT angiogram if needed. And third, trust your instincts. If something feels off and it's not going away, your body might be trying to tell you something. Don't ignore that inner alarm. We've been trained to only look for chest pain when it comes to the heart, but the heart speaks in more mysterious ways. It can whisper through your jaw, it can send signals through your arm, it can hide behind a stomachache, but it's always trying to warn you. If you're willing to listen, this sign is often missed until tragedy strikes. Don't be that story. Pain in odd places is not random. Sometimes it's your heart's quiet cry for help. Will you hear it? Sign number 3. Sleep disturbance and sudden anxiety. Especially at night, you go to bed feeling fine, but around 2 or 3 in the morning, you're wide awake. Your heart feels like it's racing. You can't breathe deeply. You feel a strange sense of doom, like something is wrong, but you can't explain what. This isn't just poor sleep, and it's not just anxiety. This could be your heart trying to warn you in the only way it can. Here's what most people don't know. In the days or weeks before a major heart event, many patients report sudden insomnia, night sweats, panic, or restlessness. But because there's no pain and it happens at night, they write it off as stress or overthinking. What's really happening? Blocked arteries reduce consistent blood flow, and when blood flow drops, especially while your body is at rest, your brain and nervous system go on high alert. Adrenaline spikes, your breathing changes, your heartbeat becomes erratic or speeds up. You wake up suddenly feeling like you're choking or something bad is about to happen. It's not mental, it's neurological and cardiac, and it's one of the least understood warning signs. Ask yourself this. Have you been waking up between 1 a.m. and 4 a.m. with your heart pounding or a feeling of fear? Do you find it hard to sleep even when you're physically tired? Have you noticed unexplained night sweats or waking up with nausea? Is your sleep restless with your mind racing even if there's no stress in your life? If these things sound familiar, they could be connected to your heart health. Let me share a case. A 52-year-old woman had no heart history. She lived a quiet, healthy lifestyle. But for 2 weeks, she kept waking up around 3 a.m., gasping, heart pounding. Her doctor first said it was anxiety, but something didn't feel right. She pushed for a full cardiac exam. Results? 3 blocked arteries, 1 at 95%. She had surgery just days before. What doctors said could have been a fatal heart attack. Her only clue? Sleep panic. Here's the truth. Your body is always trying to communicate, and when you're asleep, without distractions, those messages become clearer. But if you ignore them or mask them with sleeping pills or caffeine the next day, you might miss the warning entirely. So what should you do if your nights feel strange or disrupted? First, track your sleep. Write down what time you wake up, what you feel, and how often it happens. Look for patterns. Second, pay attention to symptoms that combine. If your sleep issues come with shortness of breath, nausea, chest heaviness, or dizziness, get evaluated immediately. Third, don't let anyone tell you it's just in your head. You know your body, and sudden panic, restlessness, or insomnia with no emotional trigger is a sign that something deeper might be wrong. Here's a good rule of thumb. If your nights feel more dangerous than your days, it's time to take action. The heart is connected to your nervous system. When blood flow drops, your brain doesn't feel safe. It activates your fight or flight system even when there's no danger. That's why you can feel panic, dread, or a sense of impending doom for no clear reason. And while it may sound scary, it's actually your body doing its job. It's trying to wake you up before something worse happens. So if you've been brushing off those 3 a.m. wake-ups, if you've been ignoring the racing heart and sweaty palms at night, stop. Take this seriously. Talk to your doctor. Ask for tests. Get real answers, not assumptions. Because what you're feeling may not be in your head. It may be in your heart, and this could be your only chance to catch it before it catches you. If even one of these signs we've talked about feels familiar, don't wait, don't second guess it. Take action now. Ignoring the signals your body gives you isn't bravery, it's risk. And when it comes to your heart, that risk can turn fatal fast. So here's what you can do starting today. Immediate heart protection checklist. Get a stress test or ECG. If you're over 35, especially if you felt tired, anxious or had odd pain, get your heart rhythm and function checked. Request a CT angiogram. Don't settle for vague answers. This test shows actual blockages and artery conditions, not just guesswork. Get your lipid profile tested. Look beyond cholesterol. Pay attention to triglycerides, LDL and inflammation markers like HSCRP. Start walking daily. Just 30 minutes a day helps your heart pump stronger, clears your arteries and lowers blood pressure. Cut down sugar and fried foods. These spike inflammation and clog arteries faster than you think. Small changes equals big results over time. Add magnesium and omega-3s. These help your heart stay calm, regulate rhythm and reduce artery stiffness. Ask your doctor about the right dosage for you. Track your symptoms daily. Write down energy levels, sleep quality, pain or panic episodes. Patterns reveal problems that one-time tests might miss. Your heart won't always shout. Sometimes it whispers. But if you ignore those whispers long enough, they stop. Your future self will thank you for paying attention today. Your kids, your spouse, the people who love you, they'll be grateful you didn't wait. Pain isn't always the first sign. In many cases, the lack of pain is the biggest warning. So listen now, before you never get the chance again. Today might not feel different, but it could be the day you finally decide to listen, truly listen to your body. That constant tiredness, that strange jaw pain, those sleepless, restless nights, they're not just life stuff, they could be warnings. And if you've made it this far into the video, it's not a coincidence. You were meant to hear this. This message found you for a reason. Your life is too important, your heart too valuable to ignore another sign. Silent heart blockages are called silent for a reason. They don't scream, they wait, and if you keep waiting too, you may never get another chance to act. So let this be your sign. Maybe the most important one you'll ever get. Comment, I won't ignore the signs anymore. Like if you learned something today that could protect your life. Subscribe for more real life-saving health truths, no fluff. Share this with someone you love. Don't wait for them to collapse to say, I should have told them.